This video will help you understand your Risk for Transport dashboard. Click on the Risk for Transport tab to get a deeper look into who may be at risk for transport over the next 30-day period. Risk scores are based on settings that were set up by your organization. On the left is the number of people who are at risk for transport in your organization for the next 30-day period. The middle panel shows the comparison between the stratification groups in your organization. Based on your setup and the actual care recipients being monitored, you can expect to see between 2% and 5% of your population flagged as high risk. A 12-month trend of your high-risk population and actual transport incidents is shown on the right. Keep an eye out for new high-risk, patient risk score, and score changes. Care recipients who have been classified within the last 7 days as high risk for transport will have a circle around the red dot beside their risk score. These red dots should prompt evaluation and follow-up based on your protocols. The Risk for Transport score is intended to help you identify opportunities for early intervention and help you reduce emergency transport. Once signaled as high risk, it may take a few weeks to a couple of months for a score to return to a lower risk category. Using the Predictive Analytics Risk for Transport scores helps you identify those patients who may need additional support or intervention. Also, you may want to create protocols and regularly evaluate patients who are medium to high risk. This group may need periodic home visits, therapy changes, or clinical visits to help manage and prevent rising acuity. When you click on a patient name, the patient scorecard will pop out. This card enables you to become more familiar with a patient, their demographics, medical conditions, and incidents signaled through the Philips Lifeline Medical Alert system. Reviewing the patient scorecard prior to checking on or calling the patient will also help you determine the right approach to coordinate better care. Remember that the medical diagnoses listed on a patient scorecard may not be comprehensive and may present a subset of conditions provided to Philips by your organization or self-reported by the patient. Please review your patient records and charts in addition to the dashboard. Risk factors are determined using predictive model inputs. Keep in mind that reasons for patients to be classified as high risk or to have an increasing risk for transport may not necessarily be evident in the scorecard. For instance, test calls are not shown as incidents, but our data shows that an increasing frequency of test calls may result in a higher risk for hospital transport. Those inputs are factored within the model. We recommend that you log in regularly to your Predictive Analytics account to manage your population. Keep an eye out for new high risk, patient risk score, and score changes.